Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
Did you know that excessive dessert consumption could raise your blood sugar levels as well as harm your eyesight? Studies have shown that individuals with chronically high blood sugar levels are more susceptible to retinopathy and even blurred vision. Consuming too much sugar damages the fragile blood vessels in the eye. Additionally, the lens of the eye may be affected due to the abrupt rise in glucose levels, which could be harmful. These damaged blood vessels ultimately obstruct vision. Hello everyone, I'm Dr. Soumya Saluja from SIP Media, and today we will talk about the impact of uncontrolled blood sugar levels on the eye. And to explain the difficulties these fluctuating levels can pose for the eyes, we have with us an enthusiastic educator and ophthalmologist, Dr. Sheetal Savur. Dr. Sheetal Savur is the professor and head Department of Ophthalmology at the Yenepoya Medical College in Mangalore. Dr. Sheetal has experience in managing glaucoma and cataract cases. Ma'am has numerous articles and research papers to her credit. Dr. Sheetal, SIP Media welcomes you, ma'am.
Hello.
Hello, ma'am. And as you are well aware that diabetics, they frequently experience complications with their vision. So therefore, to begin this conversation, I would like to ask that how do elevated blood sugar levels affect the eyes?
So, what happens is when the blood sugars remain elevated for a long time, there are certain changes that happen in the blood vessel. Okay. And this especially is pertinent to us because of the layer, what we call as retina, which is the light sensitive layer. It has blood vessels. And due to long standing diabetes, they get a little leaky. And what happens is, because they get leaky, there's a lot of collection of fluid inside the retina. And this especially happens in the region of the macula.
Yes, ma'am.
And this macula is responsible for the sharpest vision. So if, fluid accumulates there, it tends to blur our vision.
Okay.
And so what happens, the changes depend on the stages of diabetic retinopathy. So in earlier stages, these are the changes, but as it progresses, the light sensitive retina tends to get detached. That's when there is serious trouble. And then you can't do too much once it reaches that stage. Also, before that, there's a stage where there is bleeding inside the eyes because it gives rise to new vessels. Now, these new vessels are very fragile, they have no strength in them. So, a sneeze, a cough, you lift something heavy and they can rupture and give rise to bleeding inside the eye. So, these are the different changes that happen in the blood vessel and also in the retina and consequently affect vision.
Okay, ma'am. So, which warning signs of the condition they seek medical attention?
Okay, so there's one important thing that we need to understand about diabetes and diabetic retinopathy in particular.
Yes,
So, do you know if you're a diabetic?
that's exactly my point. How would one know that?
Yes. So that's the thing, unless you got yourself tested,
Yes, ma'am.
you wouldn't know for a very long time unless, it progresses and starts giving you symptoms. Now, we don't want to wait until that time.
Yes.
So the first thing to remember is get yourself screened for diabetes. If you happen to have diabetes, go and get your eyes checked for retinopathy.
Yes, ma'am.
Okay. Now, if it is a little more advanced, then it will present to you as blurring of vision, dark spots in front of the eyes, or flashes in front of the eyes, or, a full area of vision turning dark.
Yes.
But we don't want to wait until these warning signs come. We have to go at a stage where we seek to find out if there's anything wrong so that it doesn't come to the stage where it gives you symptoms.
Absolutely, ma'am. And how do medical professionals, the ophthalmologists in particular, could manage the diabetes associated eye problems?
Okay, so the thing is, whenever diabetes is diagnosed, first thing that they need to do is send to an ophthalmologist. Or let's say a patient walks into an ophthalmology OPD, how do
Yes.
we diagnose this condition and go about it?
Yes, ma'am.
So after a preliminary examination where we check vision, etc.,
Yes,
we
ma'am.
need to dilate the pupils. By dilatation, it means pupil is the small dark area,
Yes,
okay,
ma'am.
which allows the light to pass into the eye.
Yes.
So we need to use eye drops, dilate it so that the retina becomes visible to us. When we
Okay.
have a look at the retina, it kind of tells us what is happening in the brain and the kidney also of the
Okay.
person.
Okay.
Okay. So when we have a look at the retina, it will tell us, is it very minimal diabetic retinopathy? Is it moderate? Is it severe? Is it very severe? Is it complicated?
Mm-hmm.
So we need a couple of equipments by which we can visualize the retina and then decide what is the problem. So that's how we diagnose it.
Yes, ma'am.
Now, another thing that we have to remember is it's sometimes not only about diabetes, but the associated comorbidities. Like, for example, there's blood pressure also, which is high,
Mm-hmm.
which will worsen the diabetic retinopathy. The
Okay.
lipid levels are high, which could again worsen, the diabetic retinopathy. So there's several things like that, which will also worsen the severity of retinopathy.
Right, ma'am.
So we need to look into that also.
Okay.
And there are a couple of investigations. Okay. For
Yes, ma'am.
example, there is a OCT scan, which will tell us what is the kind of fluid accumulation that is happening inside the retina.
Yes, ma'am.
Okay. And another investigation, which used to be done in the earlier days, not so common now, is the fundus fluorescein angiography. Will
Okay.
tell us where and how much is the leakage in the retina so
Mm-hmm.
that those areas can be treated. So
Okay.
this is how we go about diagnosing
Mm-hmm.
and trying to see how much is the damage to the retina.
Okay, ma'am.
Okay. Yeah.
And as you've just suggested, that screening is the key to actually prevent the warning signs. So, do
Yeah.
you have any recommendations for preventing the impact of diabetes on the eye other than screening?
No, see, you just have to get yourself diagnosed well, keep the sugars under control because the most important risk factor for a
Mm-hmm.
diabetic to develop diabetic retinopathy is the duration of the diabetes. Okay,
Okay.
so if it's present for more than 10 years, 15 years, 20 years, then because of the time factor, the changes are bound to come. Second is the amount of blood sugar. That is, if the control is poor, if the sugar levels are very high, again, it could accelerate the retinopathy. And as I said earlier, other things like hypertension, hyperlipidemia, these are the things that could worsen the diabetic retinopathy. Actually, to sum that, you take care of all these conditions, you control your sugars, lifestyle modification, control your BP. To a certain extent, we can reduce the effect of diabetic retinopathy, especially in the early stages.
Yes,
It
ma'am.
might come down by itself without treatment.
Okay,
Yeah.
ma'am. And what if diabetes has already caused some vision loss in some individuals? So, can we help such people?
So there are three categories of management. We either treat it medically.
Mm-hmm.
Okay, that
Yes, ma'am.
is by giving lasers and intravitreal injections.
Yes, ma'am.
And the other option is surgical,
Okay, ma'am.
which generally happens in the advanced stages of diabetic retinopathy. We don't want it to reach that stage.
Yes, ma'am.
Okay. So in the initial stages, when there's accumulation of fluid inside the retina, especially in the area of the macula where the vision is maximum,
Yes,
there
ma'am.
are injections given inside the eye. Okay.
Okay.
So sometimes one injection helps if it is mild. Sometimes we need to keep repeating it a
Okay,
few
ma'am.
times. Okay, so that is one modality of treatment.
Okay, ma'am.
Now, if there are those new vessels that are formed, which I told you could rupture and bleed,
Yes,
so
ma'am.
if those vessels are formed, then we need to treat it with the help of lasers. So there are at least 2 to 3 sittings that might be required if it is, quite severe.
Yes, ma'am.
So one very important thing to remember is many times if certain amount of damage has occurred, we can't undo it.
Okay.
The only thing we can do is prevent further damage.
Absolutely.
Okay.
Yes.
And when surgical management is necessary,
Yes, ma'am.
okay, that means the damage is pretty severe. The retina is sort of come off from its underlying attachment. There's fluid accumulation. There's something pulling on it. So that's not a very good sign. There's a lot of hemorrhage inside the vitreous cavity. So
Yes, ma'am.
that's when we opt for a surgical management, and the prognosis for vision at this stage
Yes, ma'am.
is not so great. So
Okay.
we may get a good anatomical success, but functionally patient may not regain so much of vision.
Okay.
Okay, so that's an important thing to understand. So screen and prevent is the magic word for this.
Okay,
Okay.
ma'am.
Yeah.
Right. Okay. So thank you so much for being with us today, ma'am. I hope this will be of assistance to those who are experiencing vision problems as a result of these fluctuating blood sugar levels. Thank you so much
Yes.
for being with us.
Welcome. Welcome.
Thank you,
Thank
ma'am. And for more such videos, please subscribe to our channel and press the bell icon for regular updates. Thank you once again, ma'am.